think of it, a lot of people when they stretch, they tend to just stretch their hamstrings like this. She has good flexibility. So what the point of nerve flossing is she's actually going to do a little like mini sit-up, and that's going to stretch the whole nerve down the spine. So what we're going to do, I'm going to start here. If you want to get a deeper stretch, you can actually point their toe, and this is the sciatic nerve. So I'm going to come up, and then she's going to come up as well. You feel that? And down. Also, if you have people who have limited range of motion, this actually helps them get more range of motion. So like, let's say if she couldn't get past here, what I would do is just do a couple of versions of that where she comes up and down and get a little bit further each time like this. So go ahead and we'll do it a couple times. So come up and down. She didn't know I was going to make her work out at work today. And down and up and down. If you notice that their other leg, which hers isn't, she has a good flexibility, is starting to come up, what you can actually do is bring their leg this direction, go over her leg. Man, I didn't know if my flexibility was okay for that. And then don't sit on their leg, but just go lean in and down. All right, and I'm pulling on that toe. Now, if I want to do the peroneal nerve, we're going to actually tilt her foot like this with this part. You can see where my hands are. Caitlin's our photographer, so blame her for any mistakes. All right, even if they're my mistakes. All right, so come on up. You feel that a little differently?
Mm-hmm.
Feels heavenly, right?
Yeah, absolutely.
And down. There's also a way they can do this on their own. If you look at my mobility and stability playlist, there's unilateral leg kicks. It's a really good way for them to do it on their own. The next, we're going to come under their hamstring, don't grab their knee, rotate in like this, and just lean in. Come up. This gets that piriformis as well. And down. How's that feel?
Okay.
She meant great. That's what she meant to say. And down. All right. Now, what I'll also do is, definitely if they don't have the range of motion, I'll practice doing the seesaw as well. So like, I'll come up, she'll stay down. So I'll come up, no, she'll stay down.
Oh.
Then I'll go down, she'll come up. She'll come up. And up. And just do that a few times. And then eventually they should be able to get to where they can have 90 degrees. It may take a few sessions. Sometimes it helps to work on them a little bit first, work on the hamstring. And so the next one we're going to do is some ulnar nerve, median nerve flossing. So think of it like this, that that nerve's being threaded through the muscle, and lengthened. A lot of times your nerves can get real tight and cause a lot of pain. So this one's a little tricky. So Caitlin, you might have to come over here to get where my arm placement is. I'm actually going to put this blade in between her shoulder blade and her spine. All right, so we're going to raise her up. I'm going to put it right there. And then I'm going to fold her over. So see how it's kind of propped up a little bit, giving that pec a little bit of a stretch. Now, the next part we're going to have them do is tilt their head. So every time I tell them to tilt, they naturally turn like this. We don't want that. We want them to actually tilt, ear to shoulder. So try to crush your ear to your shoulder. There it is. Okay, so come back. So now that she knows what to do, you're going to grab these 3 fingers. You're going to come under there with their elbow. And just like that. Now you want to use your bicep to lean down onto them. Now go ahead and tilt. She wanted to turn for a second. And at the same time, I'm also lifting up a little bit. Get a deeper stretch in there. And come back. Can you feel the stretch?
Mm-hmm.
Okay. If they feel too much in their hands, you can just go to their wrist. I like to get a good lean in there. Make sure you're using good body mechanics as a therapist. All right, the next is the same thing, but I'm gonna do the median nerve. This is amazing for carpal tunnel. So now if you'll stand over here, Caitlin. So this time I'm going to come under here. So the same thing, this part's going in between her shoulder blade and her spine without pulling her hair. And now I'm gonna grab the middle 3 fingers. And I'm gonna put her back of her tricep in my hand, put my shoulder into her shoulder, lean forward, and I'm gonna go like this. Go ahead and tilt. Do you feel that?
Mm-hmm.
And come back. Same thing as the legs. You're gonna go do a little bit of in and out. You can do the opposite like we did earlier, or just as a therapist, make sure your shoulder's not hitting them in the chest. You know. All right, and then next we're gonna do a radial nerve stretch. So come this way, all the way to the edge. All right, a little bit more. This time we're gonna put your leg into their shoulder. Try not to turn your hips and put your butt in their face, but you're gonna have them tuck this finger in and squeeze. Now we're gonna grab that, wrap it around. I'm gonna go straight down. You may wanna come on this side, let's see. All right, we're gonna lean down and turn their wrist. And go ahead and tilt your head. Do you feel the stretch?
Mm-hmm.
And come back. And again. Yeah, my body mechanics aren't that great right now, but that one's really hard to do with good body mechanics. The next, can I have you lay on your side? So, I really like doing this one for shoulder range of motion. So what we're gonna have them do is, I wanna have her look at your hand. So look with your eyes, look at your hand. All right, hold your arm there. Put your hand into their sacrum. I like to put my elbow to my hip as well. Caitlin's trying to be tall. She may need to come over here just to see where her hand is.
Okay, go
All right, so right here, we're gonna see how I'm kind of bracing myself with my hip. Hold it here, and then hold it here. Like I'm gonna let go, so you have to hold it. All right, so now I got a good brace right there. And do you see my hand? Can you turn your head? I'm over here. My hand's over here. You see it? Can you touch your hand to my hand? Nope, keep coming. Good, turn your head. So she's gonna need to turn her head and come down and touch it. Turn your head all the way. There you go. And go back. And again, all the way over here. And back. And again, all the way down here. You feel the stretch? What that does is with her looking at it, it strengthens back here and opens their shoulders up. Helps with forward head posture as well. So go ahead and lay on your stomach. All right. Actually, before I give her this, there's what I'm gonna do now. You see, I'm gonna hold her hand in this position. Now what I want her to do is put your hand up under you like that, right there, like a push-up. And then I'm gonna lean into this, and I'm gonna have her push up a little. You feel that?
Mm-hmm.
And then she can actually reach around this direction and lean up a little bit, which is gonna get this a really good stretch. You feel that?
Mm-hmm.
So it's really good for carpal tunnel. Those people who type all day long, or play on their phones. All these are really good. You can do these on the massage table as well, like whenever they're getting a massage. The draping would be a little different, but next, I like to do it again for shoulder range of motion. Go ahead and put your head in here. Just not crush your glasses. So, can you lift your head up, turn your face this direction, put it on that. Put your hand on your head. So what I'm going to do this time is see where my hand is?
Mhm.
Can you touch my hand with and lift your head up at the same time? No, and reach this elbow around and touch me. So again, you're going to kind of do that motion. Come up. Again, go down. Come up again. I'm way over here. Almost. Down. And again. Almost. Almost. There we go. You can put your head down for a minute. So that, like I said, this is all really good to help them open their chest up, strengthen their back. The reason we look at it is if your brain sees it, it'll see that the move's safe. It'll allow the movement. If you're doing this, it's only going to allow so much. Last but not least, we're going to do is for, if you have frozen shoulder, anything like that, this is really good for that. This will be our last thing we're going to show. So put your hands here. Also good to help strengthen their lower back. But go ahead and lift your head up. All right. Do you see my hands?
Mhm.
So what we're going to have them do is lift both elbows like that. And one at a time, touch each hand with my hand. No, one at a time. So she's going to go
Oh, okay.
one and one, like she's
Okay.
swimming. Okay, again, one. You're not turning your head. You got to turn your head to the one you're going to. There we go. There we go. She did a good work.
Oh, yes, girl.
Up higher. And as they get better at it, you're going to go a little higher. She's doing so good. And then as they get good at this, you can even have them incorporate their legs and do more of like a Superman, belly angel type exercise. You can rest. But, all right, well, guys, thank you so much for watching this. I hope y'all enjoyed it. Please comment your thoughts below. If you want to see anything else, anything additional to this, let me know. I appreciate you watching. Please hit subscribe and follow us on Instagram as well. And we're also on TikTok now, so for some shorter videos, more condensed. All right, thank you guys, and have a great day.